Terrance Baker, nice to see you. Welcome here.
Thank you.
It's a pleasure that we can talk about laser therapy. You are the one who nearly started with laser therapy. Please, how come?
Yes. After finishing my undergraduate school at Johns Hopkins, I went to medical school in George Washington. And I started realizing at GW Medical School in Washington, D.C., I was actually in D.C. when President Reagan was shot and came into the emergency room at George Washington. I then continued my treatment, learning education at Medical College of Virginia. But during all those years of training, I realized that pain management was a huge problem in our nation. Already in the 80s, we were already leading the world in the use of narcotics, oxycodone, OxyContin, Percocets, other controlled substances for the management of pain. And even as a medical student, even as a resident, I knew there had to be something else. So around the year 2000, I began a search for technologies that could replace the use of medications, narcotic medications, in my practice. And that's when I found photobiomodulation. At that time, it was called low-level laser therapy, which is the same technology. We've simply renamed it to better describe it, photobiomodulation therapy. But what I found is in my studies in 2000 is that you could apply the light to painful conditions, either new pain, what we call acute pain, or chronic pain, what we call an established pain for 3 months or longer, and you could reduce the amount of pain medication that the patient needed. You were decreasing inflammation, you were decreasing swelling, because one of the common reasons you and I have pain after we get injured is swelling. So we're reducing edema, swelling. We're reducing endorphins, that is those chemicals that are in the body like histamines, that affect us and cause pain, prostaglandins. So reduce chemicals in the blood that were causing inflammation and pain, reduce swelling, and as a result it reduced pain, and patients' need for pain medication was significantly reduced. That's how I got involved, looking for a way, looking for a technology that would allow me to treat pain without prescribing narcotics.
This was to help in another way because you needed solutions.
Yes. I wanted to, and not only did I want to reduce pain, but I also wanted to accelerate healing. So light therapy, photobiomodulation therapy, has two primary functions. One is it reduces pain. Virtually every time. I would say 85 to 90% of the patients in my office, in the emergency room, in rehabilitation, or in the nursing home have a positive effect from the application of light. Next is I wanted to accelerate healing. And so it turns out that wounds and other medical conditions heal faster when you apply the light. And the analogy that I would use is sort of like if you have a battery that's dead or nearly dead in your car, and you apply the jumper cables and you apply an external source of energy, you accelerate the spinning of the engine and the starting of the engine. Well, that's exactly what we're doing when we apply external sources of light. We're supplying raw energy known as photons. Photons are little packages of light energy directly to the surface of the cell. The cell soaks it up because the cell has what I call like solar panels, like solar collectors, light collectors. They're called chromophores, but you don't need to remember chromophores, you just need to remember light collectors. So the light collectors absorb the light. They then turn it into, they put it into what we call the copper transport system, but all you need to know is it's a light transport system. It's like a rail. Yes, it's like a rail to move people from point A to point B. This is a photon rail or an energy rail to move it from the surface of the cell where it's been collected to the mitochondria. Now, once it gets to the mitochondria are the engines of the cell. What they do is they take resources and turn it into energy known as ATP. But you don't need to know energy. All you need to remember is like the gasoline of the cell. It's the fuel necessary for the cell to operate. And then once the mitochondria produces energy, then think of all the things that can happen. The cell can divide. The cell can heal itself. Internal, it can heal its membranes. External, okay? And all the other cellular functions that have been damaged or shut off can restore themselves to light, and the area that's been damaged can heal itself.
Yes. You found the laser therapy because you needed solution now. This is a huge of studies, more than 4,000 studies around this therapy. But why do so less doctors use laser therapy? Why?
Well, we've talked about three of the reasons. One is surgeons want to cut. They don't want to apply light. Insurance companies want less. They don't want more patients receiving light therapy, phototherapy, photobiomodulation therapy. They want less. And finally, the pharmacy companies don't want to use light. They want to use medications to heal you. So we've talked about the big three. Next is education. In order to educate physicians, dentists, veterinarians about this technology, it needs to become part of the curriculum at medical schools, veterinarian schools, and universities.
In the normal study program.
Yes. And universities are very cautious about engaging new technology until it's proven itself.
Is it a new technology? I think it's a very old technology, just even the Greeks cured by light, even the Egypts cured by light. Is it a real old technology?
Well, the application of lasers have only been around since the 60s. I mean, your first true laser, we talked about laser, Einstein talked about laser, but really laser wasn't developed until the 60s. So you're talking about a technology that now started in the mid-60s. What is that, 50 years? We're going on 50 years where we've been able to produce lasers. LEDs, you know, only 15, 20 years.
A little bit younger, yeah?
Yes. And so LEDs and lasers are relatively young as medical equipment. So part of it is that we didn't have the equipment necessary. The equipment was very expensive, and universities had not yet included it as part of the training of new students.
Okay.
Yes. And then finally, the last thing is politics. Politically, using lasers to treat people and to heal people politically hasn't been accepted. I mean, only just next month is our Congress in America going to have some hearings looking at photobiomodulation and its benefits to reducing the opioid crisis. President Trump has declared that there's an opioid crisis in America, and so now Congress is open-minded to looking at solutions. And one of the best solutions is photobiomodulation. And so Congress is going to have hearings about it. Now, in America, for new ideas to become embraced and become part of the standard of care, you have to have all these things happen. All these industries, pharmaceutical, insurance, surgeons, physicians, universities, and politicians must agree that this is something that would benefit the American population. Well, that's just now happening.
I think laser therapy is a service provider for all of them. And maybe the easiest integration would be to go in the different pathways for diabetics. To get some smaller parts to integrate laser therapy, maybe that would be a way to make a guerrilla marketing inside of the therapies.
Well, some specialties in medicine have. For example, many American dentists are using photobiomodulation as a routine part. For example, I go to a laser dentistry practice. My family practice dentist uses lasers from everything from cleaning to cleaning up cavities to preparing the cavity for implants. I mean, he uses laser therapy for painless laser therapy for virtually every part of my dental care. And so dentists have been the first specialty to embrace. Next, I think have been probably the next have been chiropractors in America. who deal with musculoskeletal and soft tissue injuries. American chiropractors have been the next science to incorporate it. And so now we're up to geriatricians and ER doctors and family doctors like me. Also, nursing homes are adopting it because there is no better way to prevent skin breakdown in a nursing home, no better way to heal a wound in a nursing home than laser light or LED light.
For the future, what do you think? What could be the image for laser light therapy for the future?
Yes. Well, in my class this morning, Professor Chichuka from San Diego State University, Dr. Castile from Reno, Nevada, myself from Washington, D.C., we taught a course on what we call master level applications. And in that course, what we talked about, one of the things we talked about was the fact that we see a day in the next 20 years where every general practice doctor, every general office, medical office is going to have a laser, a source of laser light, red light, something in the 640, 660 nanometer wavelength, a near infrared, something around 808 to 810, and a blue light. And they're going to have it, and it's going to be portable, and they can put it in their black bag or put it in their pocket. They're going to carry it around, and instead of the first thing they do after they do a history and do a physical, instead of reaching for a prescription pad, they're going to reach for the light.
Then the light therapy is the next generation of therapy?
I believe it is. Science fiction writers often help us all to see the future. I don't know how they do it, but in their imagination and in their writings, they write about the future. Well, in 1960, the Starship Enterprise, traveling from galaxy to galaxy, and they had an MD, a medical doctor, Dr. Bones, everybody will remember, and Dr. Bones was using medical lasers to diagnose you, scan you, to make a diagnosis, and then Bones would treat you in sick bay using laser light. Red light, infrared light, blue light, green light, yellow light. Dr. Bones had all those available to him. Well, it's interesting. If you look at Star Trek, so much of the technology has come to pass. The CAT scanner, the MRI scanner. We now in London, I believe, or MIT. At MIT, they can now transfer matter from point A to point B. So we have a transporter.
Transporter, yeah.
Okay, they can now have a replicator where they can add a liquid plastic, replicate almost anything, okay, including food stuff. And so we have replicators, transporters, scanners of all sorts. We now are working on engines that can do warp drive, okay? And so what's left out? Well, what's left out is the application of laser light, and that's now. 2018, that's
now.
It's now.
And we are starting the future.
We are.
Thank you very much for the discussion.
You're welcome.
Thank you.
Thank you.